If you've ever gone to physical therapy and they've placed these electrodes on you, you can thank this Greek physician and court physician to Emperor Claudius, Scribonius Largus, who lived from approximately 1 to 50 CE. Scribonius was part of the Roman army, but at the time, Romans were afraid of Greek physicians because they thought that they would be used as guinea pigs in their practice. This idea most likely stemmed from people like Cato the Elder, who was reportedly warning Romans of this by citing Hippocrates' bibliography, which states that it is not proper that I should save Persians as they are enemies of the Greek. Scribonius defended the Greek physicians by writing back, unless a physician's hearts are full of mercy and humanity, they are rightfully hated by all gods and men. No man bound by medical profession will give dangerous drugs to anyone, even to enemies of the state. Although, when events demand, the same physician will fight against these men as a soldier and good citizen with every means at his disposal. This is because medicine truly promises her assistance in equal measure to all those who seek her aid. And she swears to never injure anyone deliberately, for she judges men neither by their fortune or their character. He shut that down real quick. Scribonius then comes out with this hot piece, Compositiones Medicamentorum, that popularized the use of opium as a treatment for diseases. The text described using dried poppy juice or opium to treat diseases such as colds, earaches, dental pains, injuries. It also described a treatment for opium poisoning. Composiciones was separated into 3 main treatment sections: disease, poison, and surgeries, with 271 other preparations for various conditions from acapide ad calcem, or head to toe. And here's where things get interesting. He often advocated for esoteric treatments. For example, he used a torpedo ray to shock his patients to treat gout and headaches. Thus, electrotherapy is born. Now, torpedo rays range anywhere from 1 to 6 feet, and they have these organs called electric organs that are these discs that sit on either side of their head. And they use shock as a form of defense, sensory location, and capturing prey. The electric shock that's emitted from them can reach up to 220 volts, enough to take down a whole human. Today, the electrical impulses that are emitted by these electrodes are used to mimic when someone contracts and releases their muscle naturally. Since we know that our brain uses electrical impulses to talk to our muscles to be able to tell them to contract and release, and that's how we're able to do our daily function, we use EMS as an electrical muscle stimulation to be able to kind of get your brain and your muscle to talk again, because after surgery it gets all jumbled up. So with those electrical impulses, you're able to kind of connect the brain to kind of tell it to wake up. There are 2 types of electrical muscle stimulation. There's EMS, which is electrical muscle stimulation, and that's typically used after surgery to stimulate the muscle contractions. And then there's TENS, which is transcutaneous electric nerve stimulation, and that's typically used to increase blood flow to that area and decrease pain. Currently, the FDA only allows treatment of EMS to be used for medical conditions. Doctors can use it to help relax muscle spasms, retrain your muscles, or prevent muscle loss. Electrical muscle stimulation will cause repeated muscle contractions, which will strengthen any atrophied or weakened muscles. For example, after knee ligament surgery, you would use EMS to activate the muscle fibers. This will help engage your quads so that you can improve your knee extensions. But it's not all rainbows and sunshine. You'll get these electrodes attached to your leg, and the physical therapist will increase the voltage to your tolerance. And then as it's setting off the electrical impulses, you're supposed to flex your quad the entire time. And then once it's done, you get 10 seconds of break time until you're back at it again. And you keep doing this treatment until you finally get your brain to connect with your muscle. Don't forget that after all of your physical therapy appointments and your electropalooza, that you absolutely have to go ice everything. If you're wondering, it doesn't hurt, like it's not like a shock. They slowly increase to your tolerance. It kind of feels like a vibration, and it kind of also feels like a little prickly feeling, but it's not unbearable. And again, it's up to your tolerance. If it's too high, they'll lower it. So if you are going to go through EMS, you'll be fine. It's just a heads up.